I think so. Let me look.
Now you're in there.
All right, let me take a quick
I am
look.
recording now.
All right, let's see. Let's see. How do I do that? Anybody? Yeah, no worries.
Share screen.
Go to share screen and give somebody else permission to do it. How do you give somebody else permission to do it?
Oh, okay. Cancel that.
Cancel
it
that.
Like
Tools?
If not, I
maybe?
can send you a visual too. I might send it to you all. I'll do
Okay.
both. How's
Well,
that?
let's see. Let's take a look. I don't use GoToMeeting as often as I use. Oh wait, let me go up here and see. Is this another option? Switch to desktop. Help. No. All right. Hold on. Tools maybe. Show tools. Timer. No, we don't need that.
What are you trying to get everybody into the meeting?
I'm actually trying to figure out how our speaker can share screen.
I think we click on share,
Okay. Let's see if it'll work with.
or maybe they have to share on their end.
Yeah, it says weirdly to share, ask organizer to make you presenter, which is
Okay.
fine. Let me send this to you.
All right, let's see if I can. Oh wait, let's take a look at maybe where the people are. Oh wait, here we go. If I click on your name, make presenter. Yay, there we go. Hold on. Change presenter to Emily Devlin. Yes. Beautiful.
Great.
Okay. There we go.
Excellent.
All
We're
right.
business.
So
Thank you so much.
oh,
for
no
figuring it out.
worries, no worries. All right. It looks like everybody's here. Emily Kirby just did a speed getting sworn in with the town clerk. So thank you for doing that. Welcome, everybody. Thanks for everybody's patience with the technology, but it looks like we got it all squared away. For BCTV as well as GoToMeeting, let me just say this is the Monday, July 28th, 2025 meeting of Belchertown's Opioid Settlement Funds Advisory Committee. For anybody who's here as a guest, there's agendas and a flyer on the chair over there, committee members. Looks like all 7 of us are here today, right? Am I counting? No, Neil. We're missing Neil Lozier, our law enforcement representative. So hopefully maybe Neil can join us. If not, we've got 6 out of the 7 of us here, so we have a quorum. So this is an official meeting, and as I noted, BCTV is recording it as well as GoToMeeting. So call the meeting to order at about 10:06. 10:07-ish, 10:06. We have a guest speaker with us this morning, Emily Devlin from the Art Pharmacy Program. Wanted to have her first on the agenda, so we're going to do that. We'll do some introductions in just a moment. We've got probably a longer agenda than we might actually have time for, but I do want to be sure that we get to a couple of things. Particularly the committee signatory. We're going to need to take a vote on that, so as long as everybody is official and sworn in, we're good on that. And then maybe talk more about the launching of the library program, and then there's some other updates that we want to do. So if we don't get to the final part of the agenda about some of the projects we've been exploring and researching, we'll put that to the next agenda. At the end of the meeting, we'll decide on our September meeting date. Remember, we agreed we're taking the month of August off, like a lot of committees do in town government, so we will not be meeting in August. Make sense? Everybody should have an agenda and the flyer for an event in late August as well. Great. Let me then turn over to, let me welcome Emily Devlin. We have, nice to see you and meet you, person face-to-face versus email. We've had email back and forth. And we agreed that we'll give Emily about 30, maybe up to 40 minutes. We want to be sure there's time for questions. Emily's here to talk with us about the Art Pharmacy Program, what it is. I know some of the members of the committee have been to other sessions or workshops or have met people associated with the program. I myself have not. But let me just have a quick round of introduction so you know who's here, Emily, and then we'll turn it over to you. And I guess I'll start all the way over to the right.
Hi, Angela Battle. I'm the vote rep.
It's Monday. It's Monday morning.
Yep.
Hi, I'm Dave Gottsagen, Board of Health Rep.
Great to meet you.
Nice to meet you.
And I'm Gail Grammarosa. I'm the community member rep on this committee and serving as the chair.
I'm Jill Rossi. I'm the financial rep.
Chris Hogue, I'm the school rep.
Amazing. Great to meet all of you. Thank you so much for having me.
Sounds good. And as we noted, our law enforcement rep is not here, but that rounds out the committee. So Emily, let me turn it over to you in terms of what you can share about the program. And as we talked in email, even if you have some examples of what other municipalities have done with their opioid funds in relation to your programs, that could be helpful too. So take it away.
Absolutely. Great to meet all of you, and thank you for letting me join your packed agenda from what it sounds like today. So great to meet all of you. My name is Emily Devlin. I lead our strategic partnerships here at our pharmacy. So I have the amazing job of meeting with lots of individuals across the country to help implement what we do in the day-to-day. I'm a clinical social worker by training, so my background's in pediatric social work. Was a school counselor in the Boston Public Schools for years. I still live and work in Boston. But have been with Art Pharmacy for about a year at this point. I'm really excited to share more with you all. I'm gonna share slides because I'm a visual person and it is Monday morning. So we're recording back on. But we have been lucky enough to be working across the Commonwealth for about 2 years at this point through various different partnerships. Some being with large health plans, some being with large health institutions throughout the state. Some being with Mass DPH, and more recently, helping municipalities to utilize opioid settlement funds to cover the cost of Art Pharmacy community member.
Okay.
So I'm going to be focusing very much on the community or the opioid settlement funds today, but happy to answer questions as we're moving through. So I am going to share my screen. Can you see this?
We can.
I can no longer see you, which is always fun. So I'll pause at points so I can see you all.
Is it possible to
I
turn
know.
the lights off so we, it's a little darker, we'll see it
The
better.
the lights are right behind there. Hang on just a quick sec, Emily.
I didn't hear you, but I didn't see you. I was like, oh, I hear some stutter.
Yeah, maybe we
And
see
can
the
I
sides
make it?
better.
Can
Yeah.
I make it bigger? Everybody still can see.
Yeah.
Everybody's good. All right, go ahead, Emily. We'll
Fabulous.
go on. Yep.
Okay, great. So, I'm not going to go over this slide in
Can we
detail.
make it
You are all
whole
here
screen,
for a reason,
maybe?
right? We're supporting individuals.
Hang on, could we make it whole screen possibly? Because we can't see any of the writing.
I know it's hard to read the writing, but hold on. Let's
So
see.
we can see you the whole screen, but the slideshow is small underneath. So we need to
That is
make,
interesting.
it's gotta like take your place, be as big as you are.
Entire screen.
So
Let's
we can
try
s-
this.
So
I
we
know.
can
Can
see.
I make
Just
our
move
screen?
closer.
Can I make our screen
Well, it's-
bigger here too? No.
She controls the screen right now.
Okay.
Yeah. I think no matter, we'd have to be all sitting like a foot away to see that writing.
Yeah, you would have to.
How is this?
Just have her, she can send you the slide deck when she's done.
Oh yeah. Oh, you could just send us the slides. That's true.
Yeah.
Yeah,
I can send
okay.
it to you as well. Or send it to you. Does this look any better?
No. We could just listen to you when you send us the slides. We can't see those.
That is interesting.
It's because I think it's because of the format
Yeah, I think it might be the
of the
format,
Go
right?
TV and it would work
Okay,
on Zoom
here.
probably, but the Go TV.
Let me stop sharing, and I'm going to send this to you right now, Gail, just so you guys have it.
Okay.
And then we could listen.
Send it out.
Then
Yeah.
we just,
That is interesting, huh?
I think it would work on
Well,
Zoom.
we could see your slide. It's just that the first one with the text, it was a little small to read the text,
More
but
than a
we
little
could,
small.
yeah, we could see it. I mean, the slide itself showed up, but it
It's
was,
just teeny tiny.
yeah, it's tiny to
Very
read, but
tiny, huh?
Yeah.
Okay.
Gail, could you
Do you
click on the
mind
thing
if
on
I
top
keep
that says
sharing
topic?
and see if it gets does this look any different or no?
Change layout.
This is my first go-to TV foray, so we're trying
What
stuff
happens if you say
Different
hi to
format
everyone?
than
hi to
Zoom.
everyone.
Be able to hide.
All right, yay!
Oh,
All right,
sure. Good job.
we thank you, Emily Kirby.
Good job.
All right.
The youth,
Thank you, other Emily. That's
the
great.
youth
There you
gets
go.
it.
All right,
You're
so
young.
Emily Devlin now, we can't see you either, but that's okay.
all
Well,
right.
you talk
okay.
and we'll see the slides.
All right.
Great.
This is more important than you seeing.
43 million Americans. Okay.
I'm a shy person. No, it's good. So I will go into detail in this. I mean, you are all in this position and on this committee
Yeah.
Yep.
I'm not going to go into detail on this side, but I will say we at our pharmacy are focused on, I will talk in detail about arts-based social prescribing to support individuals experiencing concerns related to their mental health. So we are a nationwide company. We've been serving over, as I mentioned, the Commonwealth for 2 years, but 8 states across the country. Our real goal, right, is supporting individuals to be able to get access to this no matter what. So that means partnering with a lot of different types of organizations across that piece. So, briefly, as to what social prescribing is, and then I'll get into what the program actually does. So, when we think about a model of health, we typically think about the biopsychosocial model. So, taking our biological, psychological, and social health to really be able to support the person as a whole. And so when we think about whole person health, the biological health and psychological health side, the needs there are met pretty, pretty well across our current medical system. Biological meaning, well visits, being able to support individuals on the physical health side. Psychological health, obviously there's a ton of work to continue to do in both these areas, but we have, access to talk therapy, access to substance use treatment facilities, groups, and psychopharmacological supports. The other leg of this stool, right, the third leg is social health. And so thinking about how to connect people, particularly individuals who are lonely, socially isolated, and knowing that social health is a really big part of a person's well-being. But the reality is often that this is something that's really hard to actually find tools to support individuals to be able to utilize, right? I have folks, especially in my clinical practice still, right, that say, I'm socially isolated, lonely. My real solution is, getting out to the community and doing things, but I don't really have a scalable way to recommend or refer individuals to an opportunity to find social connection, like I would if they came with a physical health problem or an additional, social or psychological need, right? I can refer them to a doctor, can't really refer them to something in the community yet. And so at our pharmacy, we're really focused on doing just that. And so our goal is combining 2 different fields of research and to be able to deliver what we do every day. So the first one being this field of arts and health. And so arts and health, I don't know who in this room engages in the arts in any capacity. That can be from, crafting at home, doing coloring books, to, being on stage in a theater performance. The arts have been shown after decades of research to prove that it has healing capacity for individuals to find belonging, alleviate mental health and physical health disorders. And this is decades of research out of top institutions across the globe, right? And so finding an opportunity for folks to engage in the arts is a really, really important piece of supporting individuals in their health journey. The other side of this is social prescribing. Social prescribing has been around for many years in the UK and Canada, and the US healthcare system has not fully bought into it yet for many reasons, right? That the US healthcare system does not buy into things at the moment. But it is really focused on connecting individuals with non-clinical community-based activities and resources to help them improve social connection. So an individual referring folks, as I mentioned, to community-based supports, community-based activities to support their health and promote this healthy lifestyle. So at our pharmacy, we are really combining both of these fields, arts and health and social prescribing, to be able to support individuals in the community. And so I'm going to go briefly through how this works, just so you all can better understand, what it looks like for individuals. And as Gail mentioned, so we are working with Franklin in the Metro West area to support individuals through their opioid settlement funds. This is the model that we use for all of our different partnerships, but Franklin has been the first to really do that. So I will talk about the utilization of those funds after this, but I want to give you like a very clear visual as to what it looks like for community members. So it starts with a referral, and our referrals come from what we call prescribing partners. So prescribing partners are folks in the community. It can really be anybody, and the typical prescribing sounds like, right, a doctor or psychiatrist, but it can be any individual that works with folks in the community. So in Franklin, as an example, we're working with the school board, we're working with the fire and police teams, we are working with religious leaders, we are working with, primary care providers and social workers in the community, who are all prescribing partners with us. They receive a training on who would be eligible and how to make a referral. Our referrals are done through an online form. It's very easy. But those prescribing partners essentially identify individuals in the community who would be a good fit for the program. And essentially, those individuals get referred to us, and we reach out to the individuals to enroll them in the program. The care navigators on our team are the folks who do that. Our care navigators are behavioral health coaches, peer support specialists, individuals with bilingual capacity in Spanish and English who meet with the member virtually, either on the phone or online to complete an intake, where we learn a couple things about them. We learn things that they might need in terms of accessibility. So what are some mobility or behavioral health concerns that we need to be aware about? We really dive into the arts and culture piece of this. What are you interested in doing? Right? Social prescribing is very focused on not what's wrong with you, but what do you enjoy and what brings you joy to be able to meet the needs of what your concern is. So we learn about their experience with art, what they're interested in doing, and we learn about their availability to better match them. So our care navigators complete that intake. We also do a few different assessments that look at anxiety and depression, social isolation and loneliness, as well as general well-being to better understand and get a picture of that individual. And then the care navigator utilizes our platform that essentially links individuals with community-based events that are near them, that are within their schedule, that fit their accessibility needs, and support kind of their ongoing engagement. Right now in Massachusetts, I believe we have over 30,000 events that are going on within the next 60 days, which is amazing. So we partner with arts organizations across the region that we are implementing in to be able to support individuals to get to things that are meaningful for them. That can be a variety of things, right? It can be a pottery class, it can be an improv class, it can be going to a local theater and sitting in the audience, it can be attending a museum. We really like to get folks to something meaningful for them. And so that care navigator really serves as that accountability partner for the individual. So they send that list over, typically around 5 at a time, so we don't overwhelm people with the best results for that individual. The individual can pick the event that makes the most sense for them or is the most interesting. They let us know whether they need to bring a companion with them or somebody that they want to bring. That could be a friend, it could be a family member, it could be a caretaker. That's always included. For addressing social isolation and loneliness, companions should always come along, right? And the care navigator books the tickets for that event, helps the individual figure out, how they're going to get there, plan for their trip, right? Help to support them in holding them accountable to get out into the community. And that care navigator sends that all over to the individual. The individual goes and participates. So let's say they picked the pottery class at 2 p.m. on Saturday with their daughter. They get to go to the pottery class at 2 p.m. with their daughter, participate, and we check back in. Our care navigators complete a survey with the individual once the event's over. Did they go? What was it like? They complete those clinical assessments again, and they really look for that next opportunity for the individual to get back into the community. This is a cycle that we do. Typically, our treatment plans are 12 doses, so 12 events over 12 months, so about one event per month. And the individual is really, able to pick and choose what they want across that span. I can go back to that. I'm sure there's some questions on that too, but just to give some context, this is something that I get really excited about just as a clinician myself. I think something that we hear across the board as we're working with folks is, the clinical improvement across the board. As I mentioned, we're completing those assessments every month. We see some really strong clinical improvement, around 77% for folks that come in with poor mental health at baseline, month over month. We see really, really high engagement with folks. So folks who are referred by that prescribing partner completing intake and at least, one engagement, it's around 72%, which is great. And some really high satisfaction as well and adherence. And so I do want to talk about, and I may have plenty of time for questions, how we've been partnering with a few municipalities across the Commonwealth. So as I said, we started with Franklin started implementation around January, and we launched at the beginning of May. So we've been really able to support individuals through that partnership. I think many of you, it sounds like we're on the original webinar that we did in partnership with Franklin, and since then we've been working with a few municipalities to start implementation, which I'm happy to share, more information about once we get, the public go ahead to share what towns are engaging with us as well. And so we are really focused on, when we're thinking about the opioid settlement funds, supporting folks in 2 different buckets. First, supporting individuals in treatment and recovery, as well as preventing misuse of substances in terms of education. So we have a prevention bucket and a treatment and recovery bucket. We worked really closely with the town of Franklin to be able to get approval, from the state level, which has been trickled down to the rest of municipalities. It does not need to be done again to get approval for these two initiatives within those opioid settlement fund buckets. And so when we think about being able to support individuals in these two buckets, I like to think about them very differently, but also that they're addressing the same, concern. The first being this prevention bucket, and really giving individuals or providing protective benefits to combat risk factors for opioid use disorder, substance use disorders. We can have a really, really strong impact there in a couple ways, right? Increasing the social connection and feelings of belonging by attending events, increasing exposure or finding that third space of substance-free events and safe spaces in the community. This is particularly true for young adults. We've seen this in Franklin as working with the school districts, especially going into the summer, individuals where there was concern around some risk factors in the community, wanting to find third spaces, opportunities for them to have these safe spaces in the community over the summer, and utilizing art pharmacy as a tool there. Knowing that arts can provide, emotional regulation support, which helps us to prevent substance use disorders, as well as, reducing depression and anxiety as well. The other piece that we have found as potentially helpful, and we know, arts can be a huge impact on, is being able to provide, alternative to pain management, especially as it relates to utilizing opioids. The ability for individuals to, engage in something that still provides, pain management in some capacity, engaging in the art, getting in community can be helpful in that regard as well. So that's on the prevention side, so really providing those protective benefits. The other side is this recovery bucket, so individuals that are in active recovery, giving them another tool in their tool belt to support their recovery efforts. And so that can be a couple different things, right? That can be continuing this exposure to in-person substance-free activities that often folks are searching for as a part of that recovery, right? Finding that space and that new connection in the community that provides, a value towards their recovery. The other piece really being an opportunity for improved social relationships with either new individuals in the community or strengthening those relationships that might have been, more difficult during the recovery period, with children, with friends, being able to find something that's meaningful and joyful to be able to engage in. Along with that, really reducing the risk of experiencing, social isolation and loneliness, as well as reducing those symptoms of anxiety and depression, which we all know, right, help to boost motivation for treatment readiness, continued recovery practices. And so when we've been working with municipalities, Franklin has utilized opioid settlement funds for both, right? They said prevention and recovery are things in our community that we need help with both of these. Some municipalities have said, hey, we're going to utilize our pharmacy just for prevention for individuals, or just recovery for individuals that need support there. Really dependent on the municipality's need and what they're seeing in the community. And so last slide, and then I promise I will turn it over to you all for questions. So when we are working with municipalities, we're thinking through two different phases. The first being this implementation, and the second really being ongoing support. And so the implementation side, as I mentioned, that robust network of arts and culture partners is a huge piece of that implementation. So we partner with folks, on the ground in the municipality we're with and the surrounding areas to build out partnerships with arts and culture partners across that region. So this is, again, small, local businesses or, large opportunities for local museums or theaters, right? We're kind of doing both. But that is a big part of that implementation, is building out that network. The second big chunk of that implementation is the training and onboarding for these prescribing partners. So again, those folks in the community who are working with individuals to be able to support their ongoing referral. So we're conducting, usually it's around 30-minute trainings for folks, how to refer, who's a good fit, and providing them with clear resources to be able to do that. Along with that, we are meeting with folks in the municipality to establish escalation policy. How do we refer folks to, additional supports if needed within the community. We're going over, what referrals look like, if there's anything we need to know from you all. And I think really importantly, providing you with reporting and evaluation. So as I mentioned, we have the awesome opportunity when we're working with community members to give us, really good feedback as to how they are doing mental health wise, but also feedback about the program and engagement there, which we provide back to you all on a quarterly basis with de-identified data, obviously, to really better understand how the program is working. And so all of that is done usually in like a 2 to 3 month implementation. Again, very heavily led by us, but wanting your insights from the municipality as to how best work with you all. And then that ongoing support, continues throughout the partnership. And that's really, getting access for community members to get these doses of arts and culture, right? These care navigators supporting individuals to be able to access those, and providing that ongoing support in terms of program evaluation, what we need to be able to continue to support you all to utilize this funding and get folks engaged. That includes, continuing to build that network of prescribing partners and arts and culture partners, and really continuing to provide that data back to you as we're moving forward. So I'm going to pause and stop sharing my screen so I can see all of you. I will send this to you all, as afterwards, just so you can see it in more detail, but I do want to make sure I can see your faces, so hold on.
Cool.
Awesome. And thank you for letting me ramble for so long. So I'm sure you have some questions.
Let's go back to, there we go. All right, so we've switched our screen back to seeing everyone.
Okay, turn lights on.
Me too.
I guess? Yeah. Is that okay to turn lights on?
Yeah, I think we can still, everybody can still see? Maybe just turn that one off, the second one. There we go. Okay, a little bit better there.
Yeah.
Perfect.
Fluorescent lights.
Great.
Gotta get LEDs in here.
I guess I will open it up to committee members for specific questions. I know I have some. I took some notes. I will share the PowerPoint, so after you send me your slides, Emily, I'll send it out to the committee as well. Obviously, they're on the recording too, so folks who watch a video of this can see them. But what questions do committee members have?
I was really happy to hear about your background as a pediatric clinical social worker. I'm a pediatrician, and I'm very much into the mind-body connection, the biopsychosocial model. And I've used art a lot with kids with headaches and stomach aches to help them imagine it getting better. And it does half the time, or more than that, and helps with bedwetting, looking at the brain-bladder connection. So so this seems like a wonderful program. Did you work with Ruth Pody in Franklin? Is it Franklin? I imagine in Franklin County, right? Or is this outside Boston?
The town
It's
of
the
Franklin,
town of
actually.
Oh, not Franklin County.
Right.
Okay.
Yeah, believe me, I get in the same thing because I actually have somebody that I know that works for the town of, or the Franklin County, and when we
Okay.
first started
So it's not
implementing
Franklin,
it was the
we're the
same
first.
thing. Yeah, so town of Franklin, yeah.
Okay. So the question I had is, so your program is based on weekly participation in programs. When I first heard about art prescribing, I thought more about art therapy. You're not having clients or patients participants do ongoing drawing, like on a daily basis, or say drawing a chorus, because there's a lot of data about the benefits of singing, for example. They are going to like weekly classes, per se. They're not doing
They're
drawing.
going, yeah,
events?
it's a great question,
Yeah,
especially I'm coming in with the clinical background, so sometimes it's like, people are like, what are we doing? Yeah, so it is monthly art and culture experiences, but not art therapy on a weekly cadence. So, we partner, these folks are non-clinical partnerships typically, so they're your local pottery studio, they are a trip to the Museum of Fine Arts. We have a lot of partners in Springfield around like the Springfield Orchestra, because we have a partnership in Springfield. So it's not direct art therapy, it is experiencing that community aspect, which can bring a lot in terms of that social leg of that stool, right? So being able to engage in the community in a typical or natural way, finding those community connections with folks, but it is not art therapy, no. It's a good question.
So when you, I thought at first you were talking about a weekly involvement, and you're saying it's monthly. You find that a monthly thing, monthly visit to a museum or anything is enough to really make
We
a
do.
difference?
That's a great question. So it is enough for folks, and that has been kind of the model that has been practiced across the board in terms of social prescribing.
Yeah.
So, and we see, that ability to find that social connection and engage in that actually independently. Typically we see that around like 4 to 5 months. That's where we start to see that increase for individuals, but really starting and serving as that option and kind of that springboard into engaging in more community themselves. So yeah, the monthly is what we stick to, after a lot of research from our end, as well as kind of the rest of the field as well.
Thank you.
Thanks for your questions. Those are good ones.
Yeah.
I appreciate it.
Can I just ask Emily, from a practical perspective, I'm assuming that if you're talking about a cultural event, say you're partnering with, we've got a number of colleges, universities, we've got libraries, we've got, community arts groups, not only in town, but around the region. If and when there's a ticket price or an admission price, is Franklin using their opioid funds to cover that? And then I guess the other question is, what degree of facilitation of actually getting people to these events is the town of Franklin engaged in?
Yeah, great 2 questions. So what I'm going to do after this, if it's okay with you all, is to send you kind of like a draft SOW so you can see
Okay.
kind of how we structured this in the past. So how we structure it is like you saw me call it a dose. So it is a dose cycle. So essentially that dose cycle contains the cost for individuals and community members to engage in something each month, right? So that includes the individual meeting with the care navigators, utilizing the tool to be able to find the matching event. It covers the cost of the ticket of the event,
Yep.
right? So we kind of get that, like the average ticket price depending on the region and depending on the partner, and that is the dose cycle cost. So whether the individual attends something that's $200 ticket or a $25 ticket, we're kind of getting the average of that initially in that contracting period with you all, and that includes also the companion ticket as well. So as I mentioned,
yeah.
we'll also get that individual to go with them. Depending on what municipalities have done, Franklin has not opted into this, but we do offer transportation support as a part of that dose, that cycle, that like per community member per month price, that we're able to support folks with. We do that in a lot of our partnerships. We utilize Uber and Lyft typically, and rideshare options to be able to support individuals to get places. But that is something that you can do as an option if that's something, needed in your community. And we really, say to partners, if that's something right, that folks will need in terms of transportation, we're happy to include that, or happy to not, right? And that's kind of the option there. But what I'm going to do is I'm going to send you like a draft SOW with no prices or anything on it, just so you can see the structure of what's included in each of those, and then that way you can, ask questions from there as well. Happy to help.
Great, excellent.
Does that make sense?
Yep, it does. I'm assuming as well that, the assessment and referral to, and just talking about cultural and arts activities includes all kinds of stuff that's free as well, as most communities.
Absolutely.
Yeah, great.
Yep, absolutely. Yeah, and I think too, to your point on the Arts and Culture Network, right, like that, I would say is a big part of that implementation process. And I know I mentioned it, but that piece, right, and finding things that are local and things that you all already are doing, right, but helping folks to really get out of their shell and be able to engage in that, I think is a huge piece. So, great questions. Thank you.
Yeah. More questions from committee members?
I have a question. So, I see this as a great prevention thing because, as far as drug-free communities is concerned, substance-free activities are huge, and that's something that, we try to focus on and everything. And the recovery piece, I got questions about because, I know, being new in recovery and all, there's not a lot of people that are going to want to go once a month to an event. And I would see that being more, after you're in recovery, maybe over a year or 2 years, that you want to get back into the community. So have you implemented this program for people in recovery already, and what does it look like?
Yeah, that's a great question. So we are working closely with the SAFE Coalition in Franklin. So they're a treatment and recovery community-oriented, a nonprofit that's really focused on providing, my understanding, right, is group and individual, treatment support for folks in recovery. And they have what I have said to them is be able to provide kind of 2 different buckets, right? And using the prescribing partner as the person that better understands the treatment planning for the individual. It is somebody, like you said, right, that's in this space of, hey, they're not ready to engage in that capacity, then great, they're not ready for a referral. But if it's somebody that's been, towards the tail end of engaging in a group, maybe they, are right? So I think I am very much, when we're working with those prescribing partners in those roles within those recovery spaces, saying, hey, you are the person that knows best, right? You know this individual best, you know where they're at in their treatment best. And so really the goal there to have them be the guiding person and having this be both the tool in the toolbox for the individual in recovery, but also the person who's supporting individuals in that recovery, and giving them that additional support too. So we really lean on prescribing partners to make that decision for folks and support them. But that is how we've been working with folks for the most part in Franklin, is through that Safe Coalition partnership. I will say the majority, right, from our referrals are in that prevention bucket at this point, especially related to the school district and training the counselors and school administrators in that capacity as well. I hope that answers your question, and I'm happy to add more to it if that's helpful.
Yeah, that's helpful. It makes me wonder too whether, and you know what I anticipate, Emily, you know, whatever information you can send us, then we'll talk more as a group, keep learning about it. But I also wonder in that recovery mode if it's an opportunity for us to look at groups that already exist, like our recovery center in the next town over, as well as a sober home that's here in town. Can like groups of individuals do this? Say 5 or 6 guys from the sober home want to go to a musical performance. Can and it fits with their interests and their needs. Can people go as a small group to these activities as well as with just one companion?
Yeah, absolutely. And we see that a lot, actually, and thank you for calling that out. We see that in particular, we've seen that in a couple different spaces. I think the one that comes to biggest top of mind for me as immediate, because we just did this last week. We work with essentially like the DCF equivalent in New York City. We work with ACS, so kids in foster care, and that is a big piece in their group homes that we send folks to specific events that are all within their interests, right? To an event together to help with that social connection, both internally, but also, you know, introducing opportunity in the community. I think the biggest piece to call out there is we always offer the group piece, right? So that monthly kind of meetup capacity, along with things that fit their interests to provide that autonomy and choice, right? I think that is, for me, especially like in a clinical position of like, a lot of folks don't get a lot of autonomy and choice, especially if we've been, you know, experiencing, you know, concerns around our mental health and behavioral health. And so being able to provide that autonomy and choice for things that are interesting to you is really important, but we always provide that like monthly opportunity if that's something that the group we're working with has the capacity to do, and we're happy to do that as well. Yeah, great question. I love the group aspect for sure. It's great.
Cool.
Anything else? I know I'm taking up a lot of your
Oh,
time.
no worries.
One
more question.
So, looking at, so you talk about Franklin. I just looked it up. Suburb of Boston, named after Benjamin Franklin. Great. So you're involved nationally, but are you involved anywhere else in Massachusetts except the town of Franklin? Are you involved in, say, Boston? You mentioned Springfield. Yeah.
So Franklin, we are utilizing the Opioid Settlement Fund, so that's why I'm giving them as the biggest example. We have a few other municipalities that are starting this contracting process to utilize the Opioid Settlement Funds as well. We work in Springfield through a partnership with the Department of Public Health. It's individuals 55 plus as a substance use prevention opportunity. So we work in several group homes as well as with behavioral health practices out there as the referral mechanism, very similar. So that's the Springfield partnership. We work with Mass General Brigham with a few federally qualified health centers in Jamaica Plain. That is looking at hypertension, so supporting Black and brown individuals with hypertension needs. So that's one other piece. And then we work with a Medicaid dual eligible Medicare or Medicaid plan across the state. I cannot mention the name of it, unfortunately, but it's across the state. So we have about, we have folks all the way west to all the way east, and we've been serving those folks for over a year at this point. So we dabble. It's many different opportunities, I would say, and I think the biggest piece, and you can imagine, right, is that's exciting is we get to help folks across that lifespan, while also supporting individuals through various partnerships. So, lots of opportunity across the Commonwealth, which is always great.
Great. Any other questions? Lots of food for thought. We'll take a look at the slides and
Thank you.
anything else you can send us, Emily.
Absolutely.
And then we'll maybe touch base and see what people think in September. Keep talking and thinking more about it, but really appreciate your time and the information. It's an exciting program, and it's really interesting. It's really innovative. Yeah.
Thank you.
Great.
Thank you for letting me steal so much time from you guys, and thank you for having me come in virtually. I appreciate it. Let me follow up with you, Gail.
Yep.
Is it okay if I send everything to you and
Yep.
then you'll
Absolutely. Yep. Then I'll get it out.
Yeah.
Great.
Sounds great.
Well, thank you all, and please let me know what questions you have. I know I'm the type of person that, 2 hours later I have a bunch of questions, so feel free to email me at any point, and happy to address them.
Great.
Yeah.
Appreciate you.
Thank you
Yeah.
so much.
Thank you very much.
Thank you.
Great.
Bye.
Take care. Bye-bye. Have a good day.
Bye.
Okay, we're back. We're on the screen. We don't have anybody else, right, on visiting us online? Okay, no worries. We'll keep it going. We'll keep recording it and everything else. But I'm going to change glasses since I don't have to worry as much about the screen. I want to be able to look at the agenda. All right, let's take a quick. Can everybody go for maybe another half hour till about 11:15? Does that work for everybody? Yeah. If we need it, we may not even need it, but. All right, let's move on to just some of our discussion items where I was hoping that we just might touch base on things. Some of these could be 2 seconds, some of them whatever time we need. But just wanted to give the opportunity for any update on drug-free communities, BODE or any of that. I know Angela and Chris also recently went to a national meeting with other drug-free community prevention coalitions and other prevention groups. So any updates you want to share?
No.
That's okay, too. That's all right.
There's no updates as far as our grant coming through yet. Nothing's been sent out to us or anything yet.
Yep.
We are pretty positive we're going to get funding.
Good.
We were just featured in CACA as a. I don't know if you knew that.
I
BODE
did. Yep.
was featured in CACA on the newsletter, which is huge. Our project officer did send out a letter to us congratulating us, and so we have a lot of support. We're still on the CDC website as a success story coalition.
Yep. Okay.
So we are positive, feeling good about it. But if not, at least we have our a backup for now.
Exactly.
We do know that there are 3 pieces of legislation that were supposed to go, the stuff that was supposed to go through. Drug-free communities, they are trying to get it fully funded. And also the CARA grant. Stop Act, not much though. Stop Act is gone, probably. And the CARA grant and then another one. So those 3 things they want to keep out of the AHA into Office of National Drug Control Policy, which I think is great for us. So that was one of the positive things that came about it. The conference was very thin again.
Yeah.
Very, very thin. Not a lot. There was the good stuff going on, but there wasn't a lot of sessions to choose from as much anymore. I did get to talk to Pat Castillo for quite a bit, and she's the chief strategy officer for CACA, and she was just saying that they were cut the tobacco funding and stuff like that. So there's definitely shifting happening out there, but they're interested in nicotine-free generation. I had sent them stuff back in February, and Pat and Sue Tao and I met up and talked about it again. So I'm resending that all out.
All right.
I'm just
Cool.
learning these acronyms. So CACA stands for
Community Anti-Drug Coalition of America.
Oh, great.
It's our training academy
It's
through the Office of National Drug Control Policy.
I get it. And then you mentioned another one where the funding was cut. That was the Stop Act.
Stop Act.
Stop Act grant is cut, which
Stop
is
Act? What is
Stop
Well,
Act
it's
grant.
not official yet.
It's not official yet.
Officially cut yet,
But it's one of the ones that may be on the. They're not fighting for it. Just put it that way. They're not fighting for it.
Alcohol prevention. Stop Act.
Yeah,
Stop
underage
Act.
drinking. Yeah.
Stop Act.
Sober truth on prevention of underage drinking is what it stands
Oh,
for.
no, that might be cut.
Right.
Yeah, I think
So
the
yeah,
estimate
it's
was
good.
pretty
Go ahead,
thin
Angela. Yep.
for somebody like Chris, who has been around for a while and has attended a lot of those sessions. But for somebody like me, coming in for the first time, it was the perfect amount of sessions because it wasn't
right,
overwhelming,
overwhelming.
and I was just getting introduced to all of this material. So for me, I was in awe
Cool.
every session I went to. So it was a great opportunity for me to be there.
Good, excellent. I guess I would say for either or both of you, if you have anything, if you have, slides or you have any notes or anything from the conference that you think would be helpful for the committee members to take a look at, feel free to send it to me.
Yeah, they said they're
or
gonna have
links
slides
to
in about a
whatever.
week.
Yep, okay, cool.
Yeah, I took a lot of notes around the cannabis stuff in
Okay.
2025, and they again, a lot around synthetic cannabinoids,
Right.
and they're like, one of their big things is bans work, and I'm like, yes, we did this, so Sue Tao was pretty impressed by what we've been doing and stuff too.
Great.
But yeah, they talked a lot about the synthetic cannabinoids and the farm bill and the loophole and that type of thing that they're trying to get closed. So, not much of an update on it though because of everything going on.
I know, I think at the moment, obviously not,
Still.
not just this community's drug-free grant, but everybody's drug-free grant. Every other funding, I know, places like, I worked on a couple of proposals for Stop Act earlier this year as a consultant. Anyway, it's all caught up in the federal, the federal decision-making around the budget. The good news is it does look like there's at least some support here or there, but yeah, we won't really know. And as, just for folks watching online or any other way, remember this committee and the select board is behind supporting the drug-free grant, whatever happens, fully or partially, depending on what happens. And I guess my recommendation, especially since we're not meeting in August, obviously, as everything settles out at the federal level, then we can just report back to the select board and say, here's the outcome.
Right.
Here's what we're going to spend because of the outcome of the grant. So we'll keep everybody posted. I think when I went in front of the select board, I said, we'll let you know as soon as BOAT and the schools know what's happened with their drug-free application, along with everybody else who's applied across the country, either to be new or to get renewed or whatever. So I know it's a challenge. It's probably keeping some people awake at night as we wait to see what happens at the federal level. So great, thank you for the update. Just wanted to touch base. Any updates on Honest Beginnings? I know we're starting with them. They got approved for their funding just last month with the select board. So any updates?
Right. It's really helpful for people. It has been very helpful for.
Excellent. They're using the money already.
Yeah, there have been
great.
a few individuals coming in. I do want to report officially that we did not win the proposal for Franklin School to start women's sober house.
Okay. Wow.
We had hopes, but
Yep.
Our proposal was not accepted as the winning proposal. So back to square one on that, which, is what it is.
Yep.
So there will be further needs as time goes along,
Okay.
but we haven't sat down and kind of put together what's next on our, what's top
Okay.
priority right now.
Cool. Well, I'm sorry to hear that. As we talked about it at the last meeting with that property. But it also says to me, and I think this committee is totally open to it, to keep the conversation going with Honest Beginnings about not only other physical physical building and other needs that they might have. What they've been funded for now is the enrollment fees and some expenses for the gentlemen who are residents there. But given that it's right here in our town, I feel like it's the ideal place for us to be in ongoing conversation. So any other needs, and I guess I would leave the door open. This is a place where we could, have conversations. Should they want to look at a women's home, sober home, recovery support home, that I still think that's worth talking about, and with the possibility of opioid settlement funds, not only from our town, maybe there's some conversation with neighboring towns, whatever it is. So just because that building isn't
Right.
gonna necessarily be the site, I don't wanna give up on the idea of that kind of service, because I think we're in agreement that it's really needed, so.
Agreed.
So happy to have them come back and talk more, and just as they gauge what their needs are.
Okay.
Any other thoughts or questions on that with Honest Beginnings? Glad to hear a couple of people, it sounds like, already have taken advantage of it.
Yes.
Super. Rather have the money be going out there and put to use, right? Perfect. Great. All right, next on the agenda, just really quick, I had to go back and take a look at my emails, just to remind everybody, in the first round of funding that we did, not only with supporting drug-free, but we supported Jabish Brook's After School program for the students there. That program that we supported ended in May, just a couple of months ago, and I gave them till the end of July to give us a report. So I'll have that as soon as I get that from them. They were going to summarize, what they were able to achieve. But remember, they were funded from September of last year through the end of the school year. So Principal Tom Ruscio is looking to get me a report end of July. And then we'll share that amongst ourselves as well as the select board, so that the select board knows how that funding impacted those after-school program participants. Great. Just wanted to touch base on the website. Thank Jill and everybody else who's been doing that. I was on the website page today on the town, and we're, continuing to work on it. What help and what information do we all need to think about? What do you think, Jill, in terms of working with communications people? What else would be helpful for us to support?
I think we need to decide what resources,
Okay.
what overall, because we can link to something that is existing somewhere rather than pulling our resources like one
Yep.
by one.
Yep.
So I would suggest that it would be whatever is most up to date for local area resources, so that we can add that link on. We do have the 988. I asked her to really put that front and center. And what else? If anybody, if other, I'm sure there's more that we can put on.
Yep, okay. Maybe.
But it was a start.
Yep. Oh, absolutely.
The applications are on there.
Yep, I saw that, the grant applications.
If we
good.
do a survey,
Yep.
at some point, I know we've talked about that, we can add that, and the communications person is more than willing to help us get the survey out.
Yep. Great. Let me just ask both.
Brain went blank.
That's
but-
all right. We've got BOAT, we've got regional QHSUA. If BOAT has a link that we can just get to you, and as well as QHSUA, I'm also thinking about, I haven't been on the Recovery Center's website in a while, but do they have just a link that you can get to without too much navigation once you click on that link? Okay.
Yeah, they have their own website. I think they post more updates on Facebook.
Oh,
than they do
okay.
On their website. Like they'll post
Oh.
their calendar and stuff on
Okay.
Facebook more than.
Is the town okay with us putting a link to somebody's Facebook page? Would that work? Maybe the Recovery Center should be their Facebook page if that's more updated. BOAT, you have both web page and Facebook? Do you want both?
We have a Facebook page and a town page, so.
Oh, that's right, you all have a town page too. So should we just link the opioid page to the BOAT page? In other words, put BOAT page.
Yeah,
You have resources connected, correct? I mean,
on the
On
boat
the-
town
on the-
page,
on the town
I haven't
page,
looked
yeah.
at it in a while.
that would be a communications thing.
Okay.
All right, so we'll think
They
about-
have whatever we've given them.
Okay,
I-
all right, we'll check
yeah.
that out. So, I mean, that sounds like a good amount. QHSUA, Recovery Center, maybe Facebook page, BOAT, maybe web page, and/or Facebook page, either one, whatever. I guess I'm trying to think,
So the observation
if somebody
can
goes to
blank.
opioid page, how do we make it as
Support
easy as
activity.
possible
That's a
for them
really
to
good
get to
Facebook page.
resources
I mean,
without overwhelming them? One other one I think about, although I honestly feel like it still doesn't always have a lot of resources about our part of the 413 area code, but 413 cares.
yeah.
Put that one on there. I mean, maybe people want to go, but
It does have other resources.
it does have
on
other
its own.
resources too, food and housing and other things. Okay.
Okay.
We could also put Healthy Playground on there if you want other resources. 'cause
Okay.
They've been working really hard on like the food resources.
Food
list.
resources. Okay.
Can you send me?
Yeah, have everybody send to
Please.
Jill,
That will save me from searching for.
searching for them, and then you can have them all. And then I know we go through communications.
Page, sit on page.
Okay.
If not, I can look it up.
Cool. And remember, we keep saying it's an ongoing process, we'll just build on it. Now that it's up, at some point we'll get an idea of like how many people have gone to it or whatever. But it looks great, I have to say, I like it. It looks great, it's got information, it's got the grant application process, who we are, why we're here, what we're doing. And I know we have to go through and make sure it's all formatted, and we have to work with the town, because they want the website to look consistent. Which reminds me as well, if you noticed, we have a format we have to follow for the agenda for the meeting, all town committees now. So if it looks a little different, you're not imagining it, we have a standardized format from the town clerk. So we'll keep doing that so that we're following those guidelines too. Anything else on the webpage? Sounds like things will be funneled to Jill, and then we'll get those on there. Excellent. Cool. All right, I'm going to turn to Jill, our expert town accountant and financing, and the idea of what we need for the committee to have what's called a single signatory. Take it away, Jill.
So because we meet once a month, and that doesn't always, sometimes we're voting something that, okay, we're ready to give out funding, doesn't always mean that paperwork is here for the majority of us to sign, which is the normal, or the historical way of doing things in order to approve a bill to be processed. So, we have the legal option to appoint a single signatory. So we would appoint one of us as the person who has our authorization as a group to sign off on whatever invoices and payouts that we need, accounts payable, that we need to process. We would vote on that as a group. The majority, if the majority is okay with it, we would vote one person. We notify, it would be in the minutes, we'd notify the town accountant's office officially, and then that person would report back to the committee the next time, just, we signed off on this, and this. It would facilitate a much smoother process than, it's a delay. It would mitigate some of the delays in getting the funding out, because we do always come back and make, double check, we're ready to go on this. So my recommendation is that we do that in order to streamline things. And I will defer to Gail to figure out who that will be. It can't be me.
That would be. Can't be you, I know.
I vote Jill.
Can't be her.
I have conflicts, and you
Yeah, I
have
know.
conflicts.
You have conflicts, I know, right, who else is
I
funded?
nominate Gail.
All right,
I think it needs to be Gail,
Yeah.
because she doesn't
Yeah.
have conflicts
I don't have any
with
conflicts,
other
right, I'm not
Yeah.
employed by
outside
anybody, right, I think you're right.
organizations.
I'm willing, all right.
Nominate.
I nominate, wanna make it, all right,
Those in favor?
everybody's in favor, myself included, all right, so nominated and voted. Anybody second that motion? Who seconded it?
Second.
Emily Kirby seconded. Happy to do it. I also am literally within walking distance of Town Hall.
Yeah.
So any time Jill needs me to run up here and sign something, I can do that. And I think particularly with the honest beginnings, we don't want any delay whenever we need to spend money. And that ultimately, once we know what is being funded for drug-free, we don't want anything to,
Right.
hang you up at
Oh, yeah,
all if you have
correct.
expenses. We
Correct.
want to sign off on all of that. Cool. All right, great.
Thank you, Gail.
My pleasure. Town clerk will have another reason to send me email. That sounds good. Love to hear from the town clerk. All right, just in the last few minutes that we have, and like I said, maybe we'll I have two other quick questions. Just wanted to check in if I had the dates right from our last meeting. Mid-August is when the first time of the library resource thing is gonna happen, right, Chris?
Yeah. So we're doing the mid-August
At the Clapp.
pop up there, the library. I know Kirsten has invited a few people so far. Swift River is coming. I have to reach out to a few people as well.
Great.
Now I'm back. I've been out of the office for a while.
The 15th is the
It's
correct
Friday.
date.
So the 15th is a Friday night, and I think it's from 3 to 5.
3 to 5, okay.
Um,
The library, right?
I think that's what the date was on it. 3 to 5, and then
Sounds familiar.
like right after that, we also have Food Truck Friday. Boat does, so we're gonna need some help
Okay.
big time that night. But anyways, yeah. So I'll be over at the resource center. Resource thing, helping out Kirsten with that, and we'll see how it goes.
Oh,
But
see
we've
how it
already
goes.
have like a list of people that we're inviting and stuff, and I'm like, we
Good.
can't invite like a ton of, all at once. We
It's all
want
right,
to
yeah.
stagger it out,
Right, we'll see how it goes.
Um,
And as we heard, when we talked with folks from Palmer and other places that have done it, it might take, sometimes it takes a little while to build.
Yeah, and then we're going to be doing also a pop-up in the fall.
Okay.
Oh my God, I don't have my calendar with me. It's like Save a Life Day.
Okay.
So we're going to be doing a pop-up fentanyl. We're going to try to do once a month because we used to do that like several years ago, once a month, and give out Narcan.
Right, yeah.
So we're
Remember that,
attaching
yeah,
it. We're
yeah.
attaching it to something.
Mm-hmm.
So there's that Save a Life Day that we're going to attach the next pop-up to at some point.
Okay.
I'm going to need more Narcan. I've been giving it out so much lately, like at the farmers markets, right? People are coming up there. Kids are going off to college. I'm having parents come up and asking it for kids for their
Yeah.
colleges
They-
now,
they
which
should.
is new this year.
That's great. They should
Right.
be.
Education and
It's getting out.
Yes.
Everything is getting out into the public, so it gives me an opportunity to educate them around
Exactly.
fentanyl and fake pills and all other good stuff. And also, I do Narcan training with them at the table as well. So they give them a sheet so they know how to exactly use it. Because people, surprisingly, they just don't know. They don't know that if you give it to somebody that's not overdosing, it's not going to harm them. They don't know that they don't have to prime it first before you put it in.
Right.
Stuff like that. And so it's really important for us to be educated. But I have like 3 boxes left, and I need to get more from Kirsten, I guess,
Yeah,
or
I think
or
so.
Neil.
Yeah, I was gonna say, either one of them is still part of the
Right.
municipal program where you can get it.
So
Does
what time
any-
will your meeting be, what time is the Clapp Library meeting that day?
I think it's 3 to 5.
That's what I
Okay, that's
wrote at
this-
our last.
Is that the same time as the boat, food truck? Those come after, right?
No, the food truck Fridays after, yeah.
Like 5.
Yeah, so we have my coworker will be setting up. We're gonna have hopefully a couple volunteers helping her set up at Food Truck Friday. But we're doing kids activities, like some really cool stuff, fun stuff too. So that'll be great, for the prevention piece. But we also have every time we table, we have a wheel that we spin, and we have like a couple different balls and also trivia questions where kids can whatever their thumb lands on, they answer, and it's all around like protective factors. So it's pretty cool.
Cool.
And the parents are right there, and they can hear what they're saying,
Right.
And I always ask, who's your one trusted adult at school? And the parents always want to hear that, and because they know, And so it's we always do that, but we're doing some other, because it's Food Truck Friday, we're doing some fun activity things.
Cool.
So, yeah. but we have 6 events that we're tabling at before August 15th.
Okay.
So it's a little insane.
Wow. Great.
So it sounds like you have volunteers, but if you need any more folks, let me know.
I will, definitely.
volunteer.
That would be
Yeah,
so helpful.
Okay,
Cool.
sure. Love
All
to.
right, thanks, Dave.
That's great.
Sure, yeah.
And if I remember right, we said Clapp Library was springing for the pizza for the first August 15th.
We
one.
are?
No, the
Oh,
Clapp
the library is, yeah.
is.
Library said
is.
they were doing that.
So
yeah.
just
That's
keep in
nice.
mind, if,
Yeah.
again, I think the dollars that this committee recommends, how we spend them, could cover expenses
Right.
associated with
And
that.
it's really not going to cost that much money for each time either. Like, I mean, I'm
I
like,
think
what,
we could.
maximum $50 maybe?
I know. And to me, totally reasonable. I think it's
And-
a,
And maybe next time
Justifiable.
we meet, we kind of preemptively vote that
Yes. Yeah.
expenses
do
and
that,
maybe
yes.
have an idea of what
How
those
it
might
might
be. And
be.
if there's something out of the ordinary, then maybe we could separately vote, but have kind of a blanket,
Yeah.
you know,
yeah, let's do
for
that.
these
Yep.
basic expenses.
Right.
You know, we're good with paying. I think that would make the most sense rather than trying to come time by time. There's certain
Yep.
things, you know,
Yep.
treats, you know, snacks and
Yeah,
whatever
that's just right.
are gonna be,
Exactly.
yeah.
Mm-hmm.
Do a guesstimate, yeah, for the library resource thing. We'll do that.
Can we talk about naming the library resource thing?
Yeah.
As
yes.
an, as an
I thought
event,
about
yeah,
that
what do you
too.
wanna call it?
I don't know.
We have ideas.
I
It's
just
a
don't
good-
like calling it the library
The
resource
library
thing.
thing, right, I
Yeah,
know,
the
right?
library
It's a
thing.
good point. It's a good
I think,
point.
yeah, I think we need to, I think there needs to
Oh,
be
it's good
some kind of a moniker to that so
I
that
know, to make it clear.
well,
right.
first of all, for people to understand, like as time goes on,
Yeah.
you know, if we call it the library thing, well, what library
What
thing?
is that, right?
Fun and Games Friday. Fun and Games Prevention Friday. Fun and Games around prevention.
Okay,
What does Palmer call theirs?
the library thing.
The library? No, they gotta have
I think Fun and Games Friday has a
Fun
ring
and
to it.
Games Friday.
There's a ring to it. Fun and Games Friday. It doesn't
Games
exactly
Friday.
explain it.
I don't have a sample of Palmer's.
Well, their group is called Palmer for Tomorrow, but
The library resource thing is separate.
Free Resource Friday.
Yeah.
Okay.
I can't
FR,
remember.
Free Resource
Oh, maybe
Friday.
Free Resource Friday?
Free Resource Friday.
I think they do because I feel like I've heard Stephanie say it. I just
I don't know if it's like wide.
Because we're
no.
not,
With
we're
something
not
that's a
sticking
little
to,
more, it's a little more compelling
strictly
than
to
resource.
recovery.
resource
Right.
thing, yeah.
Where-
Resource.
Where it's gonna be
Food,
like,
everything.
okay.
Yeah.
Okay, free resource Friday, how do we feel about
Resource
that?
Friday? I was just looking to see if we got.
Come to the first.
Free and Fun Resource Friday.
I'm not good with acronyms.
I know, I'm not, it's not necessarily my strong suit either to
What
come up
exactly,
with.
kids are playing games?
Triple F. Free fun food. Resources.
With snacks.
I know, I think the snacks is not a bad thing to emphasize.
Fun
I don't
and
know.
Where's your AI when you need it?
Fun and
Okay.
Food Friday.
I'm
used
surprised
AI.
Jill didn't already chat.
I
Fun and
used
Food
AI
Friday.
for an acronym, and it was for a post-overdose program, and
Yeah.
it came up with post-overdose outreach program.
Oh,
I do,
That's awesome.
I know,
maybe not.
Maybe we won't rely on AI.
I
Here's,
do,
yeah, wait, here's an
Fun
idea.
and Food Friday.
Oh.
You gotta probably have it, no, I don't have an idea for a name.
Oh.
Ask the people who come on the 15th, what should we call this?
Oh.
That's a good idea.
What if nobody comes?
Well, ask the
I just say
resource,
it's the library resource.
ask the other providers.
All right,
or
I'll do that. That'll be
agencies.
my little job. All right, I'll ask around.
And if anybody has a really good idea between now and the 15th, shoot
Okay.
it
Doesn't
over
look
to
like you've liked
Chris.
any of my ideas so far. I'm not
No, which one did you say, what, you said,
gonna-
what,
Fun and
for
Food
Friday?
Friday, Fun and Games Friday, I don't know, it's not explanatory enough or something.
I just worry if we do like a food and Friday, people are gonna be like, well, that's food truck Friday.
Fun,
Yeah.
okay.
Right,
So fun
Oh,
and
yeah.
I
fun
know,
games
fun and
Friday.
games,
It
well,
doesn't tell you what it is.
Fun
I know,
games.
right, that's the challenge, isn't it, Emma, to think about,
It's more.
it's more, I don't, and I heard somebody say the word resources is not exactly rolling off everybody's tongue.
When I see Stephanie, I'll ask what they call
Okay,
Yeah.
all right,
What's a good?
next week.
next week, okay, all right,
What's
so
a
we'll
good-
find out for Palmer,
Including.
other committee members will keep thinking about it.
We could try ChatGPT, but.
You could try it, AI.
I think Kirsten is doing a flyer for this.
Yeah, okay.
So I can see what she said
Maybe
for this time.
Okay.
For this
And
time,
then-
we'll see what she calls it for this time, and then we'll get some more
Alright, get
feedback.
more input, right. get
Yeah,
some more
because I think
thoughts.
she's doing the flyer for that.
Resource roundup.
Community
Actually,
Connect,
did I do
neighbor
the
to
flyer
neighbor,
for that?
the resource
No, I lied. I
roundup.
did the flyer for it.
Helping Hands
I've been in
Hub,
office for a couple of
monthly community exchange, gather and give, nourish and network, the giving table, heart of the community, the
Oh.
monthly harvest,
Part of the community.
resource revival, second helpings and second chances, and thrive together, the good share, recovery and renewal rally. I don't know. That was a really
Okay.
fast and dirty, terrible prompt.
I gotta
Alright,
go.
so-
I have a meeting.
ChatGPT.
We'll
I gotta go too.
explore. All right, I know.
Okay,
that
I
was
do have to leave.
11:15. I want to get you all out of here. All right, so we'll keep thinking about a name. It'll happen. You'll be able to report on how it went at the September meeting. So, speaking of which, last thing to make a decision about. There's 5 Mondays in September, so I wanted to know whether we're going with the 22nd or the 29th at our usual 10 a.m. time. Any preference? Remember, no meeting.
I'm gonna say the 22nd, just
Okay.
to keep it the 4th.
Keep it the 4th Monday, because I think that's
the only reason.
Okay,
22nd?
22nd, all right, that
I
works
won't
for
be-
me.
I won't be here the 22nd, but that's okay. I just can't be.
Okay,
I'll be out of town.
all right, so
Yeah.
September 22nd, 10 a.m. here, and
Yeah.
virtual, obviously
Okay.
on GoToMeeting as well.
Yeah.
Should I look to invite somebody from Boston about their fund for
Yes.
funeral expenses and all that?
Yes.
All right, let me see if I can get somebody
You know, I
to
don't
come
know if
talk
I
to us about that, because I
told you
want to
guys this,
pursue
but I ran
that
into
too.
that person that lost the son last year by suicide. He died by suicide. He was found in the woods. Do you remember that last year? That guy. I met the mom
Yeah.
recently, and that would have helped.
Wow,
Like
Yeah.
that, our stuff would have helped.
right,
Yeah.
right.
I think it's really important for us to get that established. I just don't know how.
I know, it's, yeah. I think that's what we've always struggled with. We like the concept, we think it's needed, you know, how do they actually implement it? And remember, Boston is just about post-overdose death expenses. There are some other communities that I've heard of who are looking at that, plus other kinds of expenses, so. All right, well, I'll see if I can get somebody from Boston maybe to join us virtually, and we'll take a look at, you know, what they've put in place.
Don't forget
September
this.
22nd, yes, thank you. Everybody should have one of these with their agenda. Do you want to say any more?
Yep,
Chris?
Angela wants to say more because she is actually helping big time to put this together, and I
Cool.
am gonna step out because I
Okay.
have a meeting.
No worries, great, thank you. We'll keep our fingers crossed about DFC for August. All right, take it away, Angela.
Okay, so we put together a sort of a timeline. Find it.
For the event, you mean? Yep.
For the event.
Okay, great.
Okay, this is my final revision here. Okay, so Wednesday, August 28th from 6 to 8. 5:30 to 6, we're having volunteer setup time. So we're going to do table setups, arrange the candles, maybe have some music playing, volunteer greet and guide early guests, and then from 6 to 6:45, this is going to be open reflection time. So guests are invited to arrive and move through the spaces at their own pace. There's going to be a memory table with a wall of light, so people are going to be invited to bring a photo if they would like, of somebody that they want to remember. We're going to have rock painting with dragonflies or hearts or whatever December, so we'll have a few different already painted to give people ideas if they want to do that, or they can do kindness rocks and they can paint
Nice,
around
yeah.
town, something like that. We're gonna have a comfort and care station, water, tissues, reflection cards, things like that. We're gonna have the resource tables, and then a legacy and action table. So that's where people will share one way that you'll carry your loved one's legacy forward. At 6:45, I'm gonna open it up. I'm gonna say something that I have to figure out, and then I'm gonna introduce Aaron Saunders. And then we're gonna do the candle relay. So that's when after he speaks, I'll light the first candle, and then the flame will be passed from person to person.
Cool.
From 7 to 7:15. So Aline will be there. She has a poem she's gonna read. That's also gonna be open up to whoever, if somebody has, a poem or something, a letter to somebody, anything that they wanna share. 7:15 to 7:30. That's when the names of the loved ones are going to be read out loud, followed by a moment of silence, and then 7:30 to 7:45 will be open mic. So anybody that wants to share a story, anything like that, I'm going to reach out to a few people ahead of time so that we have at least 3 or 4 people definitely sharing to kind of grease the wheels a little bit, and then after that, closing words.
Sounds great.
Sounds great.
Sounds wonderful. Sounds like all great ways to participate, in any ways. Yeah, wonderful. Great. So again, that's August 28th, 6 to 8 p.m., Belchertown Common, for anybody who's going to watch this. And I'm assuming, let us know if there's anything else we can do to get the word out. But I know I've seen flyers myself already around town, so I know the word is getting
Have
out.
we given it to Kate?
Not yet. So
Okay.
I just finished this. I sent
Okay.
it over to Chris and Aline to get their final, and they, so now we're going to do the press release, which I'll finish today. I'll get that over to
Beautiful.
Kate, and we'll go from there. And probably have a Facebook page, I'm thinking, or like an event page,
Event
so
page.
that I can be adding the different things that are going to be going on to keep pushing it up in people's feeds and reminding them of, that it's
Excellent.
happening.
And where's doing theirs the next day?
The next day. Okay, so August 29th is where? Okay, I'm going to make a note of that as well. Great.
It'll be from 6:30 to 7:30.
Okay, excellent.
We are putting out flags Monday the 25th on the town common. If anybody wants to help put out, we think we have like 2,400 flags.
Right,
that
I
we're
remember
gonna
the
be
flags from last year.
putting
Right,
out.
right.
So we'll be on the
Mhm.
common at 10 a.m. on the 25th.
Okay, great. Any other thoughts, questions? Sounds like an excellent event. We'll do our best to help get the word out. The town, obviously, through its communications. And then it sounds like, I'm guessing that maybe both the Belchertown and the Ware event, I'm guessing the Recovery Center and other groups will be promoting both of those events as well. Excellent. Thank you for organizing it. I'm glad to see that we'll be doing it right here in town.
Yeah.
Excellent.
Yeah, I think it's going to be a good event.
All right, I'm sorry I kept you over time. I'm gonna close out our meeting. Anybody wanna make a motion to adjourn? So moved, second?
Second.
I got a motion and a second. We will adjourn at about 11:25. No meeting in August, and we'll see you on September 22nd for our next meeting. Thanks, everybody.
Angela, I might have stuff for you. I'll text you. With signage and, I don't know, I might have some things from Vigil's past, so.
All right, I can turn this off, right? I can leave. Can't read that. There we go. End session for all.